Welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. And I have my co-host and a couple special guests. So we'll start with Verde at the end.
Hey guys, Verde Golombieski, nurse practitioner here at RevitalyzeMD, and we'll just go right down the line.
Hi, I'm Marissa Staten with RevitalyzeMD. I'm the medical esthetician and laser technician.
And I'm Paul Fulford. I'm in global product marketing and development with Lutronic Inc.
So we are fortunate to have Paul in town and on our podcast to tell us all things Accufit, because it's one of our favorite devices. We love Accufit. And this is a muscle stimulating device, and it's a third generation, and it does all the things, takes you through a workout, and we're going to talk about that and a lot of the science behind it. And if you haven't seen our other one, first off, like and subscribe, hit the bell, share with friends. But we have another podcast that we covered more kind of general overview, the evolution of EMS devices. And now we're going to get more into the details and science on Accufit.
So, we've talked about it before, but kind of to recap, like one of the things I think that makes Accufit, completely different is the way it was designed from the ground up, right? Mm-hmm. So Accufit is anatomically correct, and it's going to move the muscle and mimic the muscle the way that you would do a movement, a functional movement, right? It's going to be placed and the waveforms are as such, and you adjust the energy to make it move the way you want it to, right?
And directly to the muscle. Directly
to the muscle where it is on the body. It's also, you can treat full body with the exception of chest, right? So the nice thing about that is that if you can't treat one side when you're strengthening another, you're actually decreasing range of motion. So how is that functional for someone, right? If you can only treat a specific area, like the lower abdominal area, for example, right? But you can't do that other movement on the other side. What are you doing? You're creating an imbalance, right?
Mm-hmm.
So
everything has a push and pull.
Right,
yes.
Right. So that's another thing. It's the only device that changes the workout based on where you place it on the body, right? With vascular treatments, you don't treat a red vein the same way you treat a blue vein, right? Mm-hmm. It's different settings, right? Mm-hmm. The body's no different, right? The core doesn't move the same way as your legs or your arms, right? So you need different sized, hand pieces to, get to the proper end to end. And you also need different ways the waveform interacts with those muscle groups to move it the way you want, right? Mm-hmm. So that's another thing that Accufit is the only one that does. And then lastly, and it's something that's, again, super more clinical in nature, but we can explain it, I think, pretty easy, is impedance monitoring. And Accufit is the only one that has that. Well, why that's so important is that when you contract the muscle, regardless of like it being a physical workout or any one of the other stimulation devices, we covered that they're more based off confusion than movement, right? But it still stimulates and they can provide results, right? Is that with impedance monitoring, if you don't have it, you can have two people that are same body types. Like let's say one person's at 60% and they're fine, and the other person's at 60% and they're jumping off the table. Mm-hmm. They have different resistance and impedance, right? Different BMIs have different resistance and impedance. But where it's different is that every single muscle treatment, the resistance and impedance changes throughout the treatment. Why does it do that? Well, when you contract the muscle, you're bringing blood to the area. It changes the salinity of that area, so it will change the resistance and impedance. Accufit's the only one that accounts for that in the background. It's doing all these calculations per second to make sure that the handpieces are communicating amongst themselves appropriately. And if it faces resistance, it provides more oomph, right? So to break it down, if you had, let's say, a 100-gallon drum of full water over here, mm-hmm. and then you had an empty 100-gallon drum over here, right? And you had a 5-foot wide pipe connecting the two of them. And you open up this floodgate. Let's say it takes like a minute and a half for the water to go over, right? Well, then you redo the experiment, but you take that 5-foot wide pipe and you make it 1 foot wide, right? Smaller opening. You open that floodgate. Let's say it takes double the time, like 3 minutes, right? Mm-hmm. How do you get that water over there in a minute and a half with a smaller opening? Same container, same volume, pressure, right? So you give it more force to have it go faster, right? So if Accufit faces resistance of any kind, it doesn't change the milliamps, it changes the watts. So it changes the force behind it to get through it, so it stays consistent. So that's, again, another consistency piece and a safety piece.
So you're saying the machine is constantly getting feedback from the patient during treatment and adjusting per that individual patient's needs.
It's a reason why we don't have to keep pushing the treatment, right? You get to a point of diminishing returns with Accufit where you're just making it more uncomfortable for them. If you're getting that good contraction and it's good, you don't have to keep increasing because it's about engagement.
So you're saying it doesn't have to be a competition.
No.
So, I was going to say, so you're saying we don't
have to try to beat each other.
No. Your goal is to have your number low because that means you have a leaner, more dense muscle
Oh, well, there
mass,
you go.
right?
Well,
There
then
you
I
go.
win.
I'm winning. Yeah.
See, it's all perspective, right?
We could twist this.
There we
Yes,
go.
yes.
There you go.
Yeah, there's sometimes a little competition in our office.
And it
Just a
happens.
little.
It happens
Yeah.
with friends that do the treatments. Well, what percentage are you at?
Because
You
we
know,
always
yeah.
think more is better. So it's like, did you get to 100 yet? No.
Damn, how did she get that high?
Yeah.
I'm gonna
Yeah.
beat her today.
Yeah.
So it's a lot, right? Lastly, when you look at how to properly deliver, the electrical current like safely and with less skin sensitivity, naturally electricity, when it comes into an electrode, right, and it's flat surfaced, it wants to move science physics wise to the edges. It becomes very edge sensitive, right? Well, with Accufit, there's a patented vortex webbing that's on the handpiece that allows for even distribution. It's like having 100 different endpoints on there. So you have more control of the energy, right? And it's more comfortably delivered, right? So we can deliver a lot more energy safely to have that control.
So they don't get like a little square at the end of it on the external
There's no
burn.
red marks.
No, because
No risk of burns or
Yes.
anything like that.
And we've never had any, because again, it's probably not heat. Like we have a lot that will heat with surface stuff on other lasers. And this one, we've never had any issues with skin stuff at all. But so you're going direct to the muscle. Again, it's kind of getting feedback and changing really the force, like the watts behind it, because we're not changing, the milliamps on, but this goes very high, like much higher than home devices.
Oh yeah.
Because at first I had to look at like, what does tens mean versus, EMS.
And then versus the other
Versus
other products that are out there and how it
versus
compares.
electromagnetic and all that. So this
and
one
ultimately
does
we landed on this one because this one does everything and
everything.
more effectively and efficiently, in our opinion.
Well, it's direct. It takes you through a workout. And again, there's no other device that does that. And
Exactly.
so that's...
Paul, can you tell us a little bit about the different stages that it goes through,
Sure.
the cycle it goes through? Because I think that makes it very unique.
Yeah, it does. And again, that's like where you've got muscle confusion versus actual muscle contraction or movement, right? And that's where this is different. You have multiple planes of movement, right? So this, because of the way that it works and it's anatomical, it's going to mimic movements on all planes of movement, like high intensity interval training does. You have sustained contraction, you have cross contraction, you have regular contractions, and you have fast twitch contractions, right? So you are trying to engage all that muscle the way that you can.
That's what I'm thinking about every single time I'm going
right.
Like every single time I'm thinking.
Gotta think it. Am I doing all the things?
This is what my muscle's doing right now.
Am I doing all the things?
It's a fast twitch.
It's a fast twitch. Well, and again, that's
this is a damn hold, and I just gotta count it out.
Well, it is, and I think another thing that's a misnomer for people is like you're kind of born with this certain number of fast twitch and long twitch muscle fibers, right? Like sustained, right? Where like you
brain
can
waves all of it,
you can influence your body, but there's also genetics at play in, right? And we talked earlier about the all-encompassing approach. It's fueling the body as well, right? Like some of the things that we tell people to do after a treatment like this is increase your protein intake.
Just like you would after a workout,
for sure, right? So again, some of the other ways that technology is different are what you had mentioned, like how it's being utilized. I mean, with the different movements. So it's going to mimic, like, for example, the first movement for the core is a medicine ball twist, which would be side to side, right? And the body physically moves side to side. This is where the laughter normally starts in the treatment, right? When they're like realizing their body's doing this and they're not telling them to, right?
Yeah. It's a very, bizarre first time.
Yeah.
Yes.
And then you get used to it.
And then all of a sudden you're done with that and then hold mode comes and you're like, oh yeah.
That's
right?
the worst.
It's intense.
20-second contraction in this area, right?
Oh, yeah.
And then you've got the grip mode, which is like doing a sit up, taking this elbow to this knee and this elbow to this knee, which is, like helping with that cross movement. And you feel it moving around. It's like a kind of like a shiatsu massager almost digging in. You feel it moving
I
around.
wouldn't call it that comfortable.
There's nothing massaging about it.
Well, patients will ask you, is it comfortable, right? They'll ask you all the time.
I don't know what you got going on during it, girl.
So when you're doing treatments, right?
We won't
patients,
leave you alone with her.
Oh yeah, I was gonna say, look, listen. I
we
think
promise.
They're trust tree, right? This is a trust tree.
Yes,
right?
correct. Yeah.
So, doing treatments, right? Like you can probably attest to the fact that it's definitely fun to do the treatments with people because laughter occurs a lot, right? Because there's like I'm moving and I'm not telling my body to do this, right?
With the glute.
Yeah, bounces right?
Yeah.
Oh yeah.
So
and shakes.
Yes.
So we were just talking about treatments and you mentioned like, I'm not sure that's how it feels, right?
Yeah.
So again, when it comes to comfort, it's not something that is painful. It can be intense, right? I think, and you can definitely feel it.
And we don't want it to be painful.
Right.
It shouldn't be painful.
So like your feedback that you get regularly is, if it is painful, that we want to stop, right? There's something that either we need to adjust the placement on, or they have something underlying maybe they didn't know, right? So, what your experience when doing treatments, like what has been the regular feedback, during the treatment and then as they've gone through treatment?
Usually it's pretty comfortable. If anything, it may tickle or just feel weird like you described it first. And then I adjust as necessary. So if something feels extremely prickly, if you will, I know that I need to make an adjustment, or if one side to side feels very different, then I need to make adjustments on placement or something like that.
And it brings us to the point, like placement is so important.
Very.
And so again, we've seen in our office, even just readdressing, doing videos so that somebody can go back and look. We talk about it in team meetings, because it seems like while it should seem straightforward, it's really not. Yes. And so placement matters a lot. So that depends on the office, but I also think
and the individual patient.
Yeah.
Right.
Well, and Marissa does a lot of the treatments. And so getting, feedback and hearing, from patients and what they're saying during the treatment is so crucial to somebody that might want to try it. So no pain.
No pain.
No.
It should not be
Intense at
painful.
times.
Yeah.
Intense.
But I
Some
mean,
intensity.
yeah.
You got to. You're working out.
Yeah.
Right?
And equivalent,
without working out.
Equivalent to
down.
doing approximately how many sit-ups? Like if we were to
How
talk
do you address that?
about...
I want the exact number.
So time under tension equivalent would be 67,800 crunches in 30 minutes, right?
That's impressive.
Yeah.
That's impressive.
And you're going
What
to tell me
about
that's
the
not intense at
buttock
times.
area?
Right?
What about the buttock area? Is it how many squats?
So again, it's relative to time under tension, right? Because that's how you build muscle. Like it's not just a matter of like the duration of the treatment. It's also how the muscle is being contracted, right? To address, short contraction, long contraction, breaking down and building back up, right? So there's some in those cases also, again, when we're talking about how the device works, it works differently for the glutes, right? So it wouldn't be like the same number of crunches, for example. It's like squats, it would be more equivalent to like a glute extension, right? Where it's going to be a hold and then let go, a hold and then let go, like a deliberate. So because the glute doesn't twist, right? So twist mode for the glute would be like a deliberate, like you were doing both legs back, which you wouldn't normally do. You do one or the other, but you're doing both together and then down, and then it's holding that for 20 seconds. Now, what's cool about grip mode, right? Again, we talk about this being something that can help, strengthen areas for stability and things outside of just aesthetics, right? Well, grip mode is as if you were to take a squat bar out of a squat rack, right, and kind of bend your knees. And again, I said earlier, I'm a movie nerd. So in Major League, they'd say this is, Parkman's doing his shimmy. It makes the women in Cleveland want to puke, right? Because it's like you were to take the squat bar out, right? And you just kind of were doing 360s like this. And how those stabilization muscles work for the quads, if you were doing the quads.
So I'm sitting here rolling, thinking about it.
Right. If you were doing the glutes, how the glutes fire, right? How the glutes fire for stabilization, that's how it works them out, right? And then it's quick twitch. So for grip, it's more about stability and how it's, utilizing that, right? Because then it's also the placement, right? And with
key,
in understanding that
huge. We've realized quickly in this office.
And you have to understand anatomy a little bit, right? Where you're looking at a male and female glute, like the sartorius muscle that comes across, it comes in more aggressively for a female versus a male. So if you're not getting good contraction, you might be too close to that. So you're hitting that a little bit, right? So it's understanding, and as you do the treatments, you realize it's targeted, right? I mean, it's really, the more you do, the easier it gets. You know what to look for, right? And it's just very dialed in for people that really are looking to take the next level, whether it's fit people becoming more fit or people wanting to catalyze a lifestyle change.
One, I think that brings us to the point of and in healing and rehab where you can't work out the muscle, so you have a knee replacement and your knee's swollen and you can't do a workout, but you can do quads, and they actually have a significant quad volume loss in the first 2 weeks, even after surgery. So, again, I think it comes down to comprehensive. So I don't think that just because that's how we approach it and we feel like that's the right way, is that we're adding services that are going to augment somebody's workout and effort already. So nutrition, fitness, now you're adding something. So it's not like it's replacing anything, it's augmenting your workout. So even if you're working out, because we've had that said, well, they're super fit and they're, doing whatever Ironman competitions. This is like just augmenting that, so it's not replacing.
And it's doing, like we had talked prior to the podcast, working at the muscle out past the point of fatigue beyond what we can do. So if you're working out and then doing an Accufit treatment post a workout and running it through another HIIT series, essentially, I mean, all you're doing is benefiting that muscle and building.
And you wouldn't want to do like a heavy leg day and the next day do legs on Accufit. That's not helping you repair.
No, right? Back to back, you said, and if you haven't seen that podcast, right after, it's the time to do the Accufit. So if it's leg day, do legs after. But I think, again, addressing that comprehensively. So if we get perimenopause, menopause, we're not building muscle as well. We haven't had our hormones optimized. So optimizing hormones, so you're building muscle and then you're just metabolizing faster. So it's not like hormones or weight loss, but you're just going to metabolize faster. You're going to build muscle better. This augments it. Nutrition's huge, protein intake.
It's quality time under tension.
This lifestyle changes across the board.
It is. And you bring up, the functional side. There's, people that have hip replacements, knee replacements, right? What a lot of people are utilizing Accufit for is to basically cut that time in half, treating above and below where those things are, right? As long as they're cleared to move, right? And there's not open sutures and things like that that would be influenced. One of the things that takes a person time for recovery is not just recovering from the injury itself, MCL, ACL, hip replacement, knee replacement. It is the atrophy afterwards, right? So it's, if we can work on the areas above and below and front and back, whatever it is, where there's surgery, we can help keep that area with blood flow, keep this area, helping repair, but also contract that muscle, mimicking the way it would normally move, so that there's, minimal to no atrophy if possible, so that getting back is faster, right?
And then you pair it with something like peptides that help with inflammation and repair. And we're attacking it, more holistically all the way around, hitting all angles.
I think that atrophy, muscle loss, like the volume loss, so many studies talking about volume loss in the muscle, in the quads after surgery, and how rapid and how fast and how essential, again, hormones are for healing, peptides are for healing, like Faraday said, amino acids, nutrition,
muscle recovery.
And then it's even asymmetry. So of course you want to always clear it with a surgeon before you go and get on a machine that is contracting muscle around a joint that you just had surgery on. So I think running that by an orthopedic surgeon is, your surgeon is absolutely essential. But asymmetry. So you can actually go stronger on the leg where you had surgery and a little weaker on the other leg because there's always asymmetry after too.
It's also not uncommon for the average patient, right? Where, I would say you can't say it's 100% of the time, but 85% of the time when somebody comes in for just a core treatment, there might be a 5%, 7% difference from side to side, right? And I would say 85% of the time it has to do with what side dominant they are.
I'm going to say my dominant side is stronger than my non-dominant.
Because you utilize it more, right?
I've seen it up to 10%.
Yeah.
Difference.
Yeah. And again, you're always checking placement first, but sometimes it's just that much of an imbalance, right? And you can correct it, which helps, right?
Yeah, that's key. So placement, going to an office that's going to talk to you about all the other things you should be doing if you're not already doing them, knowing that it's placed and checked and, and you're actually getting contact and contraction before you're, kind of solidifying, just not placing them on and leaving the room,
right?
Because that doesn't work.
Well, and the other piece piece is like you see a lot of video, or you all will post videos showing them moving with the hand pieces exposed, but in actual treatment, you're wrapped and you're compressed, right? Because it's really contracting and they want to lift off the body, so you want so much full better contact, right? It's like snug as a bug in a rug, it's like your Accufit burrito. You're just, you're snugged up in there and it's nice. You really feel it like in the muscle.
Yeah, no, I agree. I love the wrapped part. And when I forget to wrap, it makes a big difference. But myself, I'm talking about.
You're right. We always show it unwrapped.
Yeah, you always show it unwrapped.
Right,
yes, you can see it.
But so Accufit is awesome. Again, 3rd generation. It is the best muscle defining, muscle stimulating device on the market, in our opinion. And we use it on a daily basis. And so if you haven't heard about it, then now you have, but share it with friends because you will want to share Accufit in the experience. If you've had it, share that too in the comments, subscribe, and let us know if there's anything else you want to hear about because we're willing to deep dive into anything wellness and aesthetics.